tetracyclines, and especially the oxytetracycline. Oxytetracycline, it's the bacteriostatic, meaning it cannot stop the growth of bacteria in recommended concentration, and its broad spectrum means it can stop the growth of every type of bacteria, gram-positive, gram-negative, aerobic, anaerobic, but it is specified to some systems like that of respiratory system mostly. So its mechanism is that it reversibly binds to the 30S ribosome. It binds to ribosome, and that leads to the disruption in protein synthesis. Bacteria is unable to synthesize the essential protein for its survival. That leads to its death. It is indicated mostly in the respiratory system and also anaplasmosis, and as it is broad spectrum at all the systems it can treat. Antagonist calcium, where there is calcium, it is said to avoid the oxytetracycline because it binds with oxytetracycline antacids milk, wherever there is calcium. Milk has the calcium, and the ferrous sulfate, it is divalent and trivalent cation. Ferrous sulfate is a divalent or trivalent cation. Calcium is also a divalent cation. So where there is divalent or trivalent cations, calcium is avoided because calcium bind with that oxidative cycline bind with calcium. So calcium is also in the bone, calcium is also in the teeth. So it also causes side effect or the bone malformation in bone malformation, and it also affects the teeth. So side effect, it causes nephrotoxicity. If patient nephrotoxicity is mainly in the patients or the animals which have already the problem of kidney. Healthy kidney, there are mostly no nephrotoxicity effect within the normal doses and within the recommended treatment protocol for 1 or 2 days. Prolonged use of oxytetracycline can cause nephrotoxicity, and if there is already a problem in kidneys, then oxytetracycline can also cause the problem. When administered at heavy doses, and it causes the calcium chelation and di or trivalent cation chelation. Calcium is divalent, ferrous is also, so it causes chelation, and it also can cause hemoglobin urea like that because of that calcium chelation. It can affect growing bone and teeth formation, cause straining of the teeth, whitening of the teeth, and in young animals. Why in young animals? Because in young animals the teeth is on the phase of growth. Adult animals, their teeth are already developed, so calcium cannot chelate that developing. Oxytetracycline cannot chelate that calcium, the calcium that is being used to make the teeth. And some hepatotoxicity may occur at large doses and to the patients which are sensitive to kidney or which already have some other disease of kidney. So note, multiple doses should not be given to horses. Multiple doses should not be given to any of the animals, especially to the horses, because multiple doses uh, can have side effects. Doxycycline is mostly used in dogs for babesiosis, and also ele and also this disease, ehrlichiosis, ehrlichiosis and babesiosis. These two diseases are treated with oxytetracycline and doxycycline treats babesiosis. Oxytetracycline is available in two forms: simple and long-acting. For long-acting, an excipient is added with the oxytetracycline. It can be PVP, polyvinyl pyrrolidine, or some other thing. We will discuss it later. And simple oxytetracycline, it is added with uh, acid and acid HCl oxytetracycline. We will also discuss it later how it is added with some other thing. But excipient for long acting is PVD and other another thing. So its dose rate is 5 to 20 mg per kg if it is used simple and long acting means that if we have to use simple oxytetracycline, we have to use the second dose. For example, if we are injecting today, second dose should have to be done at on next day after 24 hours. And if it is LA long acting, then a single dose is sufficient because its half life is for up to 2 days. And for oxytetracycline simple, we may have to repeat the dose on the second day. So now go Razomycin. This is the Star company, the famous company of Pakistan that has veterinary products. It is available as Razomycin and Razomycin LA. 5 means 50 mg per kg, 10 means 100 mg per kg per ml, and La means that if they have added some excipient, they have not mentioned that they are using PVD or uh, which agent they are using, that is making it to be a long acting or a single dose. This one should have to be used. Uh, it need two doses on consecutive days, and it needs only one dose may be sufficient. And now we study the detail of tetracycline. Tetracycline, they are mostly pure hydrochloride salt. They are tetracycline is added with hydrochloride salt to make it more stable. And calcium, magnesium, iron, or aluminum, divalent, divalent, trivalent, trivalent. They it should have to be avoided with divalent or trivalent cations because it makes insoluble chelates and they accumulate in growing teeth. That growing humans or growing animals have the process of deposition of calcium in the bones and the teeth. So if you use tetracycline, that tetracycline can bind with that calcium, and that tetracycline calcium complex can be within the bones or the teeth. Teeth it can cause the whitening of the teeth like that malformations. And we have discussed its mechanism of action. It binds 30 ribosome that leads to the disruption in the protein synthesis that are essential for the bacterial survival, and that leads to bacterial death. And it affects gram-positive, negative, aerobe, and anaerobe, almost all type of bacteria, but specifically it affects it affects the respiratory tract. Therapeutic uses uh, uh, get oxytetracycline, specifically oxytetracycline, Chlamydia, rickettsia, protozoa. Although bacteria are sensitive, Chlamydia, rickettsia, and protozoa are also sensitive to oxytetracycline. Small animals, it is Borrelia, Brucella, Hemo, Ehrlichia species in dogs, and it also feeds in birds, the sitapotin. Oxytetracycline is also used in reptiles. We will discuss it later. Pharmacokinetics, pharmacokinetics, milk and acids or iron. We have discussed it earlier that milk has calcium and acids, and iron has the iron is divalent cation, so it uh, cannot fuse with them because calcium can bind with them and it can cause the impair absorption of that. And if, for if we are using milk or antacid, we are giving antacid to any animal or any human being, then for up to 3 hours we should not have to use the oxytetracycline in these animals. And it is available, it can be absorbed in, it is available in all situations and excretions, and it is also uh, it is poorly available in CNS. It is available in CNS, but very less concentration of oxygen. So it is reported in the CNS. Doxycycline and minocycline are more lipid soluble than tetracycline, which is highly to doxycycline. Doxycycline is unique in that we will not discuss it. We will not discuss doxycycline. Administration, it can be administered in all ways, in IV, IM, and subcutaneously. Intramuscular is very painful because it has the excipient, and that excipient, actually that excipient is painful, not oxytetracycline. Oxytetracycline are administered intravenously every 8 to 12 hours. If we have to use intravenous, then we should have to dilute it with, we can dilute it with 5%, 5% glucose, or we can dilute it with ringer lactate so that its painful effects or can be reduced. So, intramuscular injection causes pain, irritation, and sterile abscesses. This can make abscess at the site of injection. Or if we give it oral, then it can disrupt the uh, oral therapeutic dosage should be avoided in adult ruminants and used with caution in horses because of danger of disrupting the luminal and colonic microflora. It disrupts the microflora that can lead to diarrhea like that, but it is within the dose or for one dose it do not have too much side effects. Using again and again for second dose, third dose, or overdose, it can disrupt the microflora. So, uh, resistance is also a problem. Uh, as compared to other antibiotics, oxytetracycline has gained, and microbes have gained more resistance against that. So it should have to be tried to use as less as possible. Uh, Pre-slaughter, if an animal is injected uh, oxytetracycline, then up to 28 days. If injected oxytetracycline, or we have placed oxytetracycline in the uterus after retention of placenta. It is also used. Oxytetracycline can also be placed within the uterus if there is retention of placenta. It can also be used intramuscular for both these conditions. We have to wait for 24 days because that is the pre-slaughter withdrawal time for that. And for 96 hours, we cannot use its milk for 4 days. We cannot use its meat for 28 days. And for pigs, you have we cannot use its meat for 14 days. For pigs, days are little bit less. Pig meat cannot be eaten for 14 days, and the ruminants or other animals, we cannot use its meat for 28 days. And milk cannot be used for 19 for 14 days. Adverse effects that tetracycline is nephrotoxic. We have discussed that it can cause tetracycline calcium phosphate complex in the animal. The calcium that is going to the enamel or the dentine calcium will bind with, and or tetracycline will bind with that, and it will create a tetracycline calcium phosphate complex in the bone or the teeth. Superinfection. Superinfection means we are treating a disease to which an animal is infected with, and if we are treating with oxytetracycline, it can cause some other. It will let the animal to be vulnerable to be attacked or to be infected with other things. What are the other infectious agents like fungus, yeast, or resistant bacteria? But it is seldom reported. And anti-anabolic. Anti-anabolic means that it decreases the growth rate of a animal, and we have said that it is also used as growth promoter. Now we are saying that it is anabolic. Growth promoter means that it increases the mass, it increases the muscle, and anti-anabolic means that it decreases the muscle. So drug is used to decrease the muscle and how it is being used as a growth promoter. So its answer is that we have said that we have studied that oxytetracycline can kill or it can be targeted against almost every type of harmful bacteria. So our purpose is to target the uh, all type of the harmful bacteria that are over there, and we will use its concentration in less amount, less than the therapeutic dose. So at that less amount, it will act as growth promoter. If it is up to the therapeutic dose or more than therapeutic dose, then it will act as anabolic. Anabolic means it decreases the body weight gain, and if it is less than that of the therapeutic dose, it can work as the growth promoter. Hepatotoxicity we are saying again and again. Phototoxicity is also, but it is the rare side effect. Phototoxicity is not reported so much. Oxytetracycline by far is it is the most commonly used tetracycline. Among the tetracyclines, oxytetracycline is most commonly used, and long-acting tetracycline is its dose rate is up to 5 to 20 mg, but 20 mg is mostly used, and when we inject 20 mg, then half-life is 21 hours. For example, if the peak concentration is 5.61 microgram at the time of injection, then half-life means half of the 5.61 will be after 24 hours. So we have to extend its half-life. We have to extend the half-life, and we do not want to inject every day for 2 days or 3 days. We have to prepare it long to convert it as long-acting. For to make it long-acting, there are three commonly excipients that are used to increase its half-life. One is propylene glycol, povidone, and 2-pyrrolidine. 2-pyrrolidone is commonly used and it has beneficial effects as compared to povidone and propylene glycol. If we have oxytetracycline solution and we want to know that whether it has propylene glycol, povidone, and pyrrolidone, but we will see, we will check that what is its composition, how much mg per ml is that antibiotic. So if it is 50 to 100 mg per ml, then the most probably it has propylene glycol or povidone, and if it has 200 mg per ml, then it will have the 2-pyrrolidone, and 200 mg per ml is more beneficial as 2-pyrrolidone is more good excipient, viscosity excipient. Why? We will discuss it later. So mostly it is used to treat the lung infection as bovine respiratory disease. It is also used in caprines and ovines for to treat respiratory problems. It is also used in mastitis and anaplasmosis. One thing that we have discussed, that it can be placed within the uterus to in case of retention of fetal membrane, but it is discouraged because it do not improve the reproductive performance. There are some studies that are saying that it do not improve the reproductive performance of the animal, and also there are some problems of residues in the milk. There are residues in the milk, every antibiotic has, but there is also study that it do not improve the reproductive performance of the animal. So oxytetracycline is used with ehrlichiosis in dogs, to photomac fever in horses, and pasteurellosis means lungs or respiratory problems in calves, and infectious bovine keratoconjunctivitis. Uh, there is a debate that it can be used for the eye disease or not, because some studies say that it is more better to use the other alternative of tetracycline other than oxytetracycline. Oxytetracycline is not recommended to be used within the uh, eye infections. Oxytetracycline can treat genital tract as it is bioavailable for the systems, the systems that are not recommended one is the eye. We will discuss it later why eye is not in eye infection. Oxytetracycline is not recommended, and central nervous system because the bioavailability of oxytetracycline in cerebrospinal fluid is not very much, and oxytetracycline it can treat the genital tract, and if we inject the oxytetracycline in shoulder, it has 98% availability. Means to say that mostly it is most recommended to inject in the shoulder, but if we inject in the neck, in neck, the favorite muscle is the trapezius muscle, that is the long muscle or big muscle of the neck, and the bioavailability is not very much different, 86% or 98%. So if we go little bit, shoulder means the scapula. Scapula bone is the muscle of the scapula we inject over there, and it has 98% availability. It is recommended. So in the horses, if we give 10 mg, then peak concentration is achieved at 30 minutes of half hour after injection. It may be the intravenous. Yes, it is intravenous because intramuscular will take long time than that. Within half hour, we will have the peak concentration, and uh, it is available everywhere when we inject intramuscular. It is available in lungs, pulmonary. It is available in kidneys. It is available in bronchial fluid. It is available in bronchial fluid. So it is used to treat the lungs infection. So it can treat corynebacteria, streptomyces, actinobacillus. The infections that are not treated with oxytetracycline are Staphylococcus aureus and Escherichia. Escherichia and other is the Salmonella. Salmonella and Pseudomonas. They are cannot be treated with the oxytetracycline. And one thing that I discussed that oxytetracycline can be used to treat the reptiles. And reptile, what are which reptiles? The studies are of sea turtles and alligators. And half-life in sea turtles is 60 hours, and the dose should be of 41 mg for first time, and for second time dose should be half 40 mg, then it will be approximately 20 mg, and for 20 mg after every 72 hours, and they should have to be injected intramuscularly. And in alligators it's half life, or simply in alligator we have to inject oxytetracycline for second dose after the 5 days. In alligators we have to inject, or in both, in nutshell, reptiles should have to be injected oxytetracycline for the second dose or after 3 days, 3 or 4 days. So now we will discuss the oxytetracycline having conventional. It is conventional means inject every day, and long-acting formulas. It has two formulations. One is conventional means inject today and tomorrow for 2 days, or maybe for third day, and long-acting means used for only once. The difference is in the viscosity. Excipient means that long-acting oxytetracycline may have the pyrrolidone, uh, but the problem is that these excipients causes the irritation, and what the irritation will let. Why the question is why we, if it is causing irritation, then why we are using that? We are using that just for the purpose because it will cause irritation for one time, and we will need not to inject it for second day or third day. So for in one single injection, it will give more sustained serum tissue concentration for up to 2 days or 3 days. For that purpose, we are using the oxytetracycline, although it is giving pain, but it is favoring the animal that it will not be injected for the second time. So oxytetracycline, another benefit is that it will have the side effect of long-acting oxytetracycline is that it has low peak serum concentration. If we are using non-long acting, then it will have the higher peak serum concentrations. But long acting has drawback that it has low peak serum concentration, but it has benefit that it has a long serum half-life that is desired. Another thing, the in pigs, there is a report that long-acting formulation did not prove any advantage for pigs. Means that in pigs, using of long-acting oxytetracycline is of no use. And if we consider another book, Oxytetracycline, tetracycline antibiotic, while many are resistant, still may useful. Many antibiotic bacteria are resistant to this antibiotic. It is its drawback we can consider it, but it cannot be used in pregnancy. It can cause pain. It can go to the it can uh, affect the brain, the bones or the teeth of the developing fetus. It can make the calcium complex with that, and it can if you use it the kidney sensitive patients should not have to use oxytetracycline, and adverse effects are GI distress. It is only if it is overdose or for more time. It should not have to be used in cats. Cats cannot tolerate it well, or if stress may break diarrhea. If oral use, do not use oxytetracycline per orally in horses as it can cause diarrhea, and in ruminants high oral doses. Every animal, if we use oxytetracycline is broad spectrum effect. It can disrupt the ruminal or the intestinal microflora, and it can cause diarrhea like that. And it can be injected as if using the IV, IM or like that. So IV rapid injection with propylene glycol, not PVD. It can cause the intravascular hemolysis and cause depression effects. So it is preferable not to use oxytetracycline that has a propylene glycol, but use the oxytetracycline that has two propylene. The other excipient we'll discuss later. Uh, uh, let's see. That has two pyrrolidone. Two pyrrolidone should have to be used. Two pyrrolidone should have to be preferred over the propylene glycol, because propylene glycol can cause hemolysis and cardio depressant, um, and oxytetracycline is used. We have discussed these things. What are the new things in this book we will discuss? The long-acting has significant slower absorption after IM injection. It is not specific to oxytetracycline. Every drug has that property, and it is available. Tetracycline is available in sputum, bile, saliva, urine, synovial fluid, but the organs where it is not available or where it is less available or where it is not recommended, they are the urinary system, aqueous and vitreous humor, and cerebrospinal fluid. Cerebrospinal fluid, because in cerebrospinal fluid it cannot achieve the therapeutic level, and in the aqueous or vitreous humor or the eye, it is not distributed to prostate and eye. So we prefer doxycycline and minocycline. Doxycycline and minocycline are preferred over the urinary system and in the eyes. Uh, and the tetracycline can cross placenta and it can affect the fetus like that. We have discussed it. Uh, Both oxytetracycline and tetracycline are eliminated unchanged primarily via it can be how it is excreted. It can be excreted through urine and also through the fecal route. And if non-biliary routes may become inactive after chelation with fecal material. It is also a point. Another thing that retarded fetal skeletal development, discolored, disease stage, we have discussed that, and it should. If we have to use oxytetracycline, then do not use the oxytetracycline. in the first half of the pregnancy. Why? And it can be used in the last half of the pregnancy. Why? Because in the last half of pregnancy, the fetus bones and teeth are the bones are already developed, and it cannot affect very much to the development of bones. And in first of pregnancy, their bones are being developed and calcium is being deposited to the bones, and that oxytetracycline can bind with that calcium and that can affect their bones. So in first half of the pregnancy, doxycycline or minocycline can be used. We have discussed renal and hepatic failure previously. Adverse effects in aden delay in bone growth, we have discussed that. High oral doses we have discussed that it can also cause reticuloschisis, or it can disrupt luminal microflora. Rapid intravenous injection causes hemolysis or hemoglobinuria. So uh, uh, what we can do to provide hemolysis or hemoglobin? We can prevent that by by diluting the oxytetracycline that has that has 2-pyrrolidone, and we have to dilute it with the normal saline or with the Bringer lactate. It is avoid the infusions that has the calcium. We should have to avoid these infusions, the infusion that has the calcium, to dilute them with the oxytetracycline. In small animals, tetracycline can cause nausea or vomiting like that. And cats cannot tolerate, do not give oxytetracycline to the cats. And the clinical sign that can be presented, the cats that have the oxytetracycline overdose, it can cause colic, fever, hair loss, and depression. Uh, and in dogs, it can cause urolith formation. So, if we are treating the uh, ehrlichiosis in the dog, then we should have to be consider that it is not sensitive to urolith formation. Uh, Humans or the people are in risk, human or cat or dog or bovine, especially at first half of the pregnancy when their bones are being developing. So, vomiting and nausea, diarrhea, we have discussed that. High oral doses and rapid annual intravenous doses of undiluted propylene glycol. Never use the propylene glycol. Propylene glycol is discouraged. It should not have to be used. 2-pyrrolidone is considered to be more safe if it is diluted. And if we have want some unwanted effects, then we can inject the uh, oxytetracy rapidly and with propylene glycol. If we want to treat the animal and or want some beneficial effects, or if we do not want some unwanted effects, then we should have to inject with slow intravenous injection slowly, or with intravenous injection diluted with normal saline or with 5% dextrose, and use the oxytetracycline that has the 2-pyrrolidone, and it should not have the propylene glycol. Rapid intravenous injection. Uh, and there is something that we will discuss later. Uh, it is saying that rapidly use of tetracycline can cause a transient collapse and cardiac arrhythmias. And there is one more solution for rapid intravenous injection. We have to inject the rapid intravenous injection. There are some studies what they are doing. They are injecting or pre-treating animals. Pre-treating means that they are injecting the animals with calcium gluconate. In Pakistan, it is available as Milfon C or Mildy4. They inject the animal with the Mildy4, and then they inject uh, rapidly the oxytetracycline. But I think it can be a stupidity. We should not have to use the animal. What is their logic behind that? I think their logic behind that will be that calcium will be in the blood when they inject calcium. Oxytetracycline will bind with the calcium, and within the blood the calcium level will be the oxytetracycline level will be less, and it will cause less hemolysis or the unwanted effects. But I think it can be a stupidity like that. We should not have to use the animal blood system, circulatory system to be a dilute. We should have to inject the animal the drug as diluted form. I think it is more better. We do not have to practice this one of injecting first the calcium gluconate, then inject the rapid IV of the oxytetracycline. Drug interaction, it work on it causes the decreased it levels, it can bind them, and beta-lactam aminoglycoside deoxin. Uh, it can increase the bioavailability of deoxin. In atovaquone, it was decreasing the bioavailability, and in digoxin, it is increasing the bioavailability of digoxin, and digoxin toxicity is reported because of oxytetracycline injection, and it can persist for months. This means that oxytetracycline is the enemy of digoxin, or if anyone wants that digoxin level to remain high, it can inject digoxin with oxytetracycline, as after injecting oxytetracycline with digoxin, the digoxin level can persist for months, or it can cause the toxicity of digoxin. Divalent trivalent cation we have discussed it many times earlier, and uh, fatal nephrotoxicity can occur by methoxyfluorine plus oxytetracycline. Warfarin tetracycline may depress plasma prothrombin like that. With more investigation we got do like very much in this one. Laboratory considerations, one thing that it can give false positive glucose, urine glucose. It also can give false negative glucose, false positive and false negative urine glucose. So if we are injecting the oxytetracycline, then we should not have to check the or test the urine glucose through the clinic test and clinistatics or test tape or any technique that is using the Benedict reagent or glucose oxidase method. If we are checking the we're checking the urine glucose level through Benedict test or glucose oxidase test after the administration of oxytetracycline, then we will definitely have the false results. We will have the false positive in Benedict's reagent, but we will have false negative. False positive means that it will tell that the urine glucose level is positive, but it will not be the positive. It may be the normal. And when we are checking through the glucose oxidase method, then it will tell the cleanliness or test it will tell or these both are use the glucose oxidase method. The glucose oxidase method will tell that the false negative urine glucose means that the urine glucose is less or there is no urine glucose, but it will not be true. It may be the more increased urine glucose test. Doses, no need to discuss the doses. They are already mentioned on the and it can be used in rabbits and rodents too. Chinchillas, gerbils, and rabbits like that. And this can be checked through the for and track it as special. They have special written it specially. These the dose rate can be checked through the manufacturer recommendation, whatever is written over there. Reptile for susceptibility infection, susceptible infections, which are the susceptible infections, respiratory system and all gram-positive infection, gram-negative infection, anaerobe, aerobe, and oxytetracycline can kill all of them. Can kill, but mostly the respiratory system it cannot affect the. It is not good for central nervous system or nervous system, and it is not good for eyes. That oxidative, specifically oxidative, not the for turtles, its dose rate is 10 mg per kg per old once daily for 7 days, useful in ulcerative stomatitis caused by vibrio. So another, the chemistry, it is very slightly soluble in water and oxytetracycline, so it is combined with HCl, oxytetracycline HCl, so that it may become freely soluble. So commercially available 50 mg per ml, 100 mg per ml, and 200 mg per ml. Propylene glycol and povidone, and propylene glycol should not have to be used because it can cause more side effects as compared to povidone. Povidone, this should have to be used, and it should have to be diluted with the uh, uh, um, ringer lactate or the distilled water. DW, 5W means uh, 5% dextrose solution, and it can be used with sodium chloride. 9% it can be used with lactate retriever. We will take oxytetracycline, we will dilute it with ringer lactate or sodium chloride or 5% distilled water, and we can inject it as the intravenous solution. Intramuscular injection need not to be diluted, but my personal experience is that if we have to inject intramuscularly, then inject as slow as possible. I inject in gourds 1 ml. If I have to inject 1 ml, then I take at least 1 or 2 minutes. I inject uh, in gourds. I am telling about the goats. Goats can easily be restrained. And what I do, I inject zero point 0.1 or zero point 0.2 ml very slowly. Then I wait for some time. Then I inject more 0.2 ml, then 0.2 ml. And if it takes 2 minutes or 3 minutes or 4 minutes, it is no problem. The slow release from the plunger or through the syringe will give less pain to the animal. If we have to inject 1 ml and if we inject it within 5 seconds or 2 seconds or like that, it is also thickening. As the viscosity is very much of that propylene glycol or like that, so it is also a little bit difficult to inject instantaneously. And if we try our best to inject as slow as possible, animal will have the less pain or may have no pain. I have tried injecting very slowly. The animal have not feel any pain. If we inject very slowly, 1 ml within 1 minute or 2 minutes, we inject little bit. If animal is feeling pain, do not inject. Stop injecting it, and then inject little bit, and we can finish injecting the oxytetracycline without giving any possible pain to the animal. Oxytetracycline can be stored in 15 to 30 degrees centigrade. All antibiotics can be mostly stored within that temperature, and povidone-based is preferred and incompatible. The drugs with which the oxytetracycline cannot be used, or the data, there is conflict of data, or data is not available, then definitely think that oxytetracycline should not have to be used on divalent or trivalent cations as iron, calcium, or milk, as milk also has the calcium. If you have given milk then or antacid, then calcium should have not be used with them. Calcium can bind with them. And amikacin, aminophylline, calcium chloride is divalent cation. So the thing that the data is there is conflict of data is the amikacin, aminophylline, carbopenicillin disodium, cephalosporin sodium. It is cephalosporin, cefepime sodium. It cannot be used with cephalosporin. It cannot be used with chloramphenicol and erythromycin. Heparin. Heparin is a calcium binder. It also binds with calcium, so it cannot be used. Hydrocortisone sodium, iron, dextran iron is divalent cation. Methicillin sodium and methoxycyl sodium, oxycillin sodium, penicillin, uh, oxycillin sodium and penicillin G, potassium and sodium are related between penicillin G and penicillin G. Let's comment that. And pentobarbital sodium, phenobarbital sodium, sodium bicarbonate. It cannot be used with tea. Uh, there that are most of them may be possibility that data is complete or data is not available. So available data, it cannot be used with the antibiotics which can bind or anything that divalent or trivalent cations. oxytetracycline means positive charge, and the things that can bind with the calcium that have the calcium. So the dosage forms, regulatory status like that, they are the commercially available drugs, IVs, bottles, all the routes are available to inject oxytetracycline, and oxytetracycline is available as free additive too. So in period it is available it will mix in small concentration to kill all the harmful or non-required bacteria or like that. And in low concentration it increases the body weight, and in the therapeutic index it decreases the body weight. So it also decreases the milk production in therapeutic doses. So consider that point that we have to increase the weight of the animal, or we want to use it as abolic. So we should have to give it as underdose. And if we want to treat the disease, then we should have to compromise with some milk production and with its little decreased growth rate. Uh, and establish residue tolerances. Uh, for example, we have injected oxytetracycline to an animal, and we have to uh, check that how much is the concentration in uncooked edible tissue. It is quite funny that we are checking in uncooked edible tissue because no one eats as uncooked. But there are different communities or different people cook in different ways, and so it may have some variable concentration. So they are checking as uncooked edible tissues how much concentration is that. So it is 1.1 ppm or 3 ppm or 1 ppm like that. Means if we are injecting oxytetracycline, we should not have to slaughter the animal for 28 days. Uh, After 28 days, we can slaughter that animal and we can eat its meat. And oxytetracycline is used to treat indominant cats. It is recommended only to treat the hemoplasmosis and the ehrlichiosis. And one thing that